Welcome to Wellness Wednesday. I'm Laurel Brennan and I'm here with Dana Laake, and it is Dana's encore visit. I was lucky enough to have Dana early in the year for a first Friday. We used to just have guests once a month, but we've had so many great guests that we had to add a Wednesday. So Dana's back for Wellness Wednesday. Thanks for being here, Dana.
I like the name Wellness Wednesday.
Yeah.
Very clever.
So I'm going to give a quick background bio. I'm going to read from the back of your book. So last time you were here, we talked about nutrition and brain health. And I just want to highlight your current focus, which is you're a licensed dietitian nutritionist, but your first love and license was a dental hygienist, and this is Dental Hygiene Month. So I brought you on for your expertise in oral health. So a real quick blurb about Dana is, like I said, she's a licensed dietitian nutritionist in Kensington, Maryland. And within her practice, she provides preventative and therapeutic medical nutrition services for the full spectrum of health issues affecting children with special needs and adults. Dana has been a partner in 3 functional medicine practices, a scientific advisor for the Autism Exchange and Neurological Health Foundation, and co-hosts the radio show and the Essentials of Healthy Living. And she was my nutritionist who helped me find hope after an MS diagnosis. So I'm thrilled to welcome you back, Dana Laake.
Well, it's nice to be here. And I like the subject. Dental hygiene is always close to my heart.
Yes. So I sent a list of things that I wanted to discuss, and you pulled from your plethora of slides. And I think you have some slides to share with us, so that way we have something to look at while we listen to you talk. Do you want to share your screen?
Okay. All righty.
Perfect. I can see it.
Very good. So we're talking about oral health effects on cardiovascular disease, inflammation, and brain health, and some controversies. We'll try to cover a lot. So basically, we're talking about where most of the bacteria that are problematic exist in the mouth. And they exist underneath the gums, in the tongue, in the whole area. So this is just a picture of a tooth, and it shows the ligaments and how the tooth sits in the bone, and it's not cemented to the bone. It's kind of like when you jump on a trampoline and the sides, the little ligaments give. And so there's some bounce, otherwise we'd break our teeth every time we ate. And so this is inflammation. And we're looking at a patient I had years and years ago, and I didn't do anything for him except take x-rays. I wanted to see what we could do with vitamin C. And this is 2 weeks on vitamin C. And he was an identical twin, and then his identical twin came in with the exact same mouth issues. But I'm using this to say this is inflammation. If you have red gums and they're not this kind of pinkish, stippled looking as you see in the lower one, then you're in trouble. And periodontitis is inflammation. Anything that ends in itis is inflammation. And it involves your genetics, your host factors, microbial factors, your diet, genetic issues. You know, this is something that's not widely discussed, that you can actually have some genes that push you toward problems with your gingiva, so that you get gingivitis, which is inflammation of the gingiva, the gums, and also periodontitis, which means around the periodontal ligament, around the bone. And what happens is people lose teeth eventually. But what's also happening is that this is really a situation where we get a lot of bad bacteria. And those bacteria have agents that can be very damaging. And so periodontitis begins by little ulcerations of the gingiva, and there's an invasion and influx of immune cells that lead to inflammatory damage to the tissues and destruction of the supporting alveolar bone. And the chronic inflammatory reaction leads to leakage of these bacterial products. And it then invites inflammatory factors, pathogenic oral bacteria into the bloodstream, where they're transported to distal tissue sites. That's anywhere in the body. And once in the systemic circulation, periodontally derived products have the potential to adversely affect a multitude of systemic diseases, either directly in situ or indirectly via amplification of the systemic inflammatory response. And the severity of these reactions can be worsened by host immune dysfunctions and genetic susceptibilities. So that's important. So over here, I don't know if you can see the pointer, but the bacteria are gathering, and they can make a pretty ugly stew in the crevice of the gingiva. And those bacterial products get out into the system. And then we see issues like what we've got here: atherosclerosis, Alzheimer's disease, obesity, strokes, pulmonary infections, inflammatory bowel disease, colon cancer, diabetes, rheumatoid arthritis, some autoimmune conditions, and pregnancy complications. And I am quite certain that most people are totally unaware of how dangerous the bacteria in the mouth can be. And what we have is over 1,000 species that communicate with each other. And some of those species are healthy. We need them. We're not healthy without some healthy bugs. So the biofilm has these microorganisms, but they can make a barrier and make themselves very resistant to antibiotics, antimicrobials. And we can use defenses against them called proteolytic enzymes. So the distal consequences, I want to impress all of the watchers and listeners that it's inflammation in general. And that's, once you have inflammation, it's like a fire, it spreads. And you can have joint inflammation, including rheumatoid arthritis, cardiovascular disease, including strokes, platelet aggregation leading to strokes, dementias, including Alzheimer's, diabetes, obesity, inflammatory bowel disease, and as I said before, pregnancy complications. Now, when I was first in dental hygiene, we knew about this, and that was in the 60s. Every hygienist knew that when a patient had their prophylaxis, there were bacteria that came out of that. And those bacteria got into the bloodstream. And so we knew that it was really a difficult problem to try and conquer. So I wanted you to see this. So there's a large study that links gum disease to dementias. So they say here the mouth is home to about 700 species. That number does vary. A recent analysis led by the NIA scientists suggests that bacteria that cause gum disease are also associated with the development of Alzheimer's disease and related dementias, especially vascular dementia. And this was in the Journal of Alzheimer's and Disease. And the analysis revealed that older adults, and this is so important, with signs of gum disease and mouth infections at baseline were more likely to develop Alzheimer's during the study period. And among those 65 years or older, both Alzheimer's diagnoses and deaths were associated with antibodies against the oral bacteria. And these bacteria just feed and grow. So we really want to focus on this inflammation. And it's the fire that spreads. And, you know, everybody has their weak areas, you know, when they're getting sick, maybe it's a headache, maybe it's a stomach ache, they feel flu-like. People have their vulnerabilities. And so when inflammation starts, that flame, that fire ends up where you're most vulnerable. It might be your joints. People will say, boy, I know when I'm getting sick, my joints hurt or my back hurts. So oral health and cardiovascular disease, we've known about this since the 60s, maybe even earlier, but the literature today is saying in the last 20 years, we have learned about it. But dentists and dental hygienists talk to patients about this in the 60s. That's a long time ago. And that there's a good amount of evidence that there's an increased risk for hardening of the arteries, the vascular atherosclerotic vascular disease, some evidence that the incidence of caries, which is another word for cavities, and tooth loss is higher in patients with cardiovascular disease, and that oral facial pain presents as the sole symptom of stroke in some patients. That's important. So there's a high quality of evidence to support an association between cardiovascular disease and oral health. And the evidence is mainly related to the association between chronic periodontitis, atherosclerotic heart disease, and is independent of confounding factors as drawn from epidemiological observational studies. That's very important. And I put this up here because we are talking about what do you do to take care of your teeth. You brush, you floss, you use water pick. There's so much that we can do now, and we have such sophisticated equipment that we can use at home, and of course, seeing a dental hygienist to have teeth cleaned. This I just wanted to put out for your information that nutritional influences on periodontal disease, vitamin A, B complex, C, D, and E, minerals such as magnesium, selenium, zinc, copper, and iron, and other factors, CoQ10 is extremely important to the health of the gum tissue. Quercetin is an anti-inflammatory, and essential fatty acids, the omega-3s. So I also have this, and you might want to provide that to people who may want to go further into what kind of omega-3, what kind of magnesium, what kind of multiple people should take. So I've put that in there. And you wanted me to cover a little bit about the fluoride issue. And I'm not sure how many people, other than people in the dental community, are very aware of fluoride issues. And for example, there was a National Academy of Sciences report back in 2006 that neurodevelopmental effects and reduced IQ was a concern. This was a major concern. They didn't say they were going to study it. They said it had already been documented that children who received fluoridated water had lower or reduced IQ levels. They also could be more susceptible to a bone cancer that's found in adolescent males, and in damage to tooth enamel from excess fluoride. And so the concerns were also impaired reproduction and fetal development. So there's been a movement that was started just about the time fluoride came out of people that wanted to avoid it. And the American Academy of Pediatrics and the American Dental Association recommend avoiding fluoride drops for infants up to age 2. And the US Public Health and Human Services has been changing the level of fluoride in the water supply. It is very difficult to try and understand the changes. They just say we keep it at an optimum level. And what is that optimum level? It's 0.7 right now. It is lower than it used to be. And they don't really like to say we are reducing it because there are side effects we're concerned about, but that was what drove this. And the EPA proposed to limit the exposure to fluoride by lowering the current legal fluoride cap in tap water and banning sulfuryl fluoride, which is in pesticides, and runoff can get into the water supply. So that's been a real problem. I love this. Hippocrates said, let thy food be thy medicine and thy medicine be thy food. Good advice, but probably a lot easier to follow in 400 BC when he didn't have to contend with 3 McDonald's, 2 Starbucks, and a Cinnabon within a 5-mile radius of the Parthenon. I really like that. And I put some resource information in there and also references. So I think that there's a lot to think about here. And I know, Laurel, that you're going to have some questions. I've put the pictures of the 2 books that we have out right now. And the ADHD and Autism Cookbook is the 3rd edition. And that book has sold over 100,000. And one of my sons said, you all didn't sell 100,000 books. You changed 100,000 households. And I thought that was very well said, very well said. So maybe you have some questions for me based on what we've, what I've talked about. You're so knowledgeable, Laura. You have such a broad breadth of knowledge. So it's always good to talk with you.
Oh, thank you. I muted because I had children and dogs running around. Thank you so much, Dana. So it was really helpful to have the visual go along with the audio. Thank you for that very much. And I think we can get back to just you and I talking. If you scroll all the way to the top and end screen share, maybe.
Stop screen share.
There you go. Now I can see you. Perfect. Yeah, so thanks again for that. That was really helpful. And of course, your knowledge goes much deeper than mine on oral health, but this is just a little piece of what I wanted to focus on. And I thought this was a good month to do it because it's Dental Hygiene Month. But this is a piece of health that you and I were talking before we went live, that it's not really part of the public discourse. And even though you knew about this in the 60s, I don't think many people still know about it today. I shared a personal story last week. For me, it's personal, because when I was 10 years old, my mom got myocarditis and was on a heart transplant list. And she thinks that it was probably directly connected to her oral health. She grew up not knowing that it was, she was supposed to floss, and she was doing lots of reading as she was trying to figure out health issues that followed her myocarditis, and discovered this as a potential trigger. And so now, as I'm trying to help clients figure out ways to avoid dementia, reduce their dementia risk, oral health is, one of the many things that we need to investigate. And one of the guests that we had, Dr. Sultana Afrouz, she, we were almost done the interview, and she said, wait, there's something I want to talk to you about, and your audience, about oral health. And the topic we were discussing was Lyme. And she said in many of her patients where she couldn't get rid of the Lyme, it turned out that it was hiding in a root canal.
Yes.
And she wanted to make sure that we circled back at some point to really focus on oral health. So along those lines, is there anything that you can share specifically about root canals? Do we already have them? Do we avoid them? What else? What are our options?
Well, the biologic dentists have different methods of handling root canals that flushes out the canal. And it's very different. It's not the traditional approach. I would say this, as far as trying to understand how, one thing I think I didn't talk about that I think is important, because I could diagnose somebody that's got periodontal disease just being in the room with them, if they are severe, because the tissues are necrosing, and necrosed tissues smell terrible. And it's one way of helping with a diagnosis. You smell that smell and you know that patient is loaded with bacteria and loaded with all kinds of problems. And so that is something that people need to pay attention to. But it can be hard. Is that breath, bad breath, is that coming from the gut, or maybe the nasal cavities and or the mouth? And sometimes it's hard to determine. You go to the dentist, you go to the doctor and try to find it out. The other way of looking, I call it reading the patient, is a tongue that's really coated, or that looks like the papilla, the little bumps on your tongue that have been sanded down. That's somebody who's severely deficient in B vitamins. And in many older people, if you go to nursing homes, you'll see that they have slick tongues. And that's, anybody with a slick tongue is definitely going to have dementia, because they are not absorbing their B vitamins, especially B12. They're very, very deficient, and their taste buds are gone. So in order to get them to eat, they have to sweeten everything because it doesn't taste. And I'd like to see much more emphasis on oral health care in nursing homes. It is neglected. There is no doubt. They just assume that people know what to do with their dentures, know what to do with brushing, and nobody needs any guidance. And it would be very important to have dental hygienists go through a nursing home, be part of the team, and be able to work on patients there. And I'm sure there are centers that do that. But right now, it's not something that's being done in all of the facilities. So they bring animals in to help people enjoy them. A friend of mine plays his guitar and sings in nursing homes, and that's wonderful. But we need dental hygienists to be more active in the care of nursing home residents. So there's a lot of controversies that have been going on in dentistry. You mentioned mercury to me in our conversation. And truly, I have talked about the fact that mercury should have been banned for use in the human mouth in 1950. There are some countries that have banned it, and I find it hard to understand why we will put mercury in the human mouth. It vaporizes, and that gets absorbed in the body, and it goes, particularly when you're talking about the mouth, the mercury can seep into the thyroid gland, and the thyroid gland can become inflamed and attack agents, because it looks like it's foreign. It's foreign now. It's not a normal thyroid. And we do see a lot of that. And so biologic dentists pay a great deal of attention, and the techniques they use for changing fillings, very thorough with suction. And I remember when I was first a dental hygienist, I thought, we had this jar and we put all the fillings in this jar, the silver fillings. They're really silver mercury amalgams, but they're not all silver. And I said, why do we do that in a sealed jar? Well, it's toxic. It's toxic in the jar.
Wow.
But it's okay in your mouth.
Right.
And I have never understood it. And I was part of the Northeast Regional Board. I was the first hygienist to serve on a board of dental examiners in the country. And it was a wonderful experience. I can't tell you how grateful I am for the experience. So the fellow who was in charge, he was our president, and he said, I want you to give a talk on what you see for the future of dentistry. And I said, you're kidding, right? You're kidding. And he said, no. I said, you want me to say where I think dentistry is going? And he said, yes. So at that time, we had finally started wearing gloves. We did not wear gloves until might have been the 70s, early 80s. And so I talked about that. I said, look, we all worked without gloves, and we couldn't believe that we were really doing that. I mean, who works in the human mouth without gloves? And everybody's nodding. And then, I go on, and I said, we are going to look back on the use of silver mercury amalgams as, what were we thinking? The damage done by those amalgams is unbelievable. And we have failed our citizens in not banning it. Now, what I think in California they had, I don't know if it's still the case or not, that in dental offices, there's a sign that says, caution, this office uses toxic mercury. Wow. And I think the minute you put that sign up, you solve the problem. Just like they say, caution, this is the x-ray room. You can't wander into that room.
Right.
And they cannot control how much mercury gets into the air. And when the CDC, or when all the medical and dental offices are evaluated, they do a mercury evaluation for the environment, but not in the human mouth. Now, there are doctors who are biologic dentists do measure that. It is measurable, and it's tricky to get rid of those. It reminds me of when you're trying to get rid of asbestos, because you're spreading it around unless you contain it. And if you're going to have it just chipped out, the fibers are going to get in the air. And that is my metaphor for trying to get rid of the mercury silver amalgams. And when I was first a dental hygienist, we were taught to polish the fillings, just like you polish silverware, right? We polish the fillings, and the fillings would break down, just like if you don't polish your silver, it gets dark, right? And the same thing happens in the mouth, only you're releasing mercury.
Wow.
And those fillings get smaller and smaller because you're losing mercury. So it's breaking down this filling. And where is it going? It's going in the body. And it's always been advised, or for a very long time, that pregnant women not have fillings placed or removed while they're pregnant. And that's very important advice. But I cannot believe I've been 55 years in dentistry or dental hygiene, in alternative functional medicine practices. I cannot believe that we have not banned mercury. And it's still the gold standard in dentistry, even though there's been a development of other kinds of materials, some of which are not ideal. It's not a perfect situation, but it's better than mercury. If somebody suggested putting lead in your teeth, no one would do that. Mercury is much more toxic.
Right. So what would you say the side effects are for mercury toxicity? I mean,
well, there's two different things. Most people don't have toxicity, they have exposure to it.
okay.
And the level of that exposure can vary, and it can challenge a person's ability to get rid of it. We have a chelation process in our bodies whereby we can get rid of toxins, but not if we're overwhelmed. You know, I don't think nature intended us to put mercury in our mouths. It just doesn't make common sense to me and to many other people who feel the same way. And I would like to also reflect back on the fluoride issue. I stopped doing fluoride treatments in children under 5 because I couldn't prevent them from eating the stuff. And they were using fluoride toothpaste and using fluoride mouth rinse. And I went to Temple University Dental Hygiene School. And they taught us, they showed, and we studied research where children died because they were swallowing so much of the solution. And I stopped doing the fluoride treatments. Now, if somebody wants a fluoride treatment, I think the paint, the fluoride varnish, they call it, is probably the least harmful way to apply fluoride. But fluoride was in everything. And in those days, there was lead in the toothpaste tubes.
Wow.
Lead. Yeah. I mean, that we're all here.
Right.
It's a miracle. And we wouldn't think of doing that now. You know, we've moved to being more conscious about our planet, about what we use, about what we eat, the cleaning the cleaning agents we use. We have gotten, I would say, quite wise in that area. But yeah, it's when I look back, I can't believe we've waited this long. It's taken this long.
Right. I want to circle back to the mercury conversation. And so if somebody's listening to this and they have 10 silver fillings, if it's a silver filling, it's a mercury filling as well, correct?
Yes.
Yes. So say they have 10 fillings, they go to their dentist, they say they're concerned about it, they want to take them out. What's the concern there?
Well, some insurance companies, I understood, would not pay for filling removal unless the filling was faulty and needed to be replaced. They weren't going to pay for people to have them removed and to have other filling agents used that did not have mercury. And I don't know where the insurance companies stand on this. The dentist, you know, obviously if there's 10, let's say there are 10 teeth that have fillings that are, they're called amalgams because it's a combination of actually silver, mercury, some copper, you know, there's some other metals that are in there because the silver is so expensive. But I do not know if the insurance companies have changed with that. I can't imagine they have. It's more, I see that as a preventive procedure. In other words, the filling is intact. It's not a problem except for the fact that there's mercury in it. Right. And the dentist, unfortunately, that you really have, just like you have in medicine, people that do functional medicine, people that do functional dentistry. And man, you are just, you're in a spacesuit when they work on you because they have to suction that mercury out of your mouth as it's being removed. And in some communities, they are prohibited from letting the residue when they have water, when they're cleaning out the tooth, they can't let that get into the sewer.
Wow.
Think about that.
Right.
The sewer.
Wow.
And it's, and I go back to the first dental office with that jar, and we would sell it. It would be sold to the labs because they would pull the silver out and we would have a party based on the money that we made from turning it back in. And that's when I started thinking, this is nuts.
Yeah.
Why are we doing it this way?
Right.
But you know, when things are done a certain way, and they've always been done a certain way, it is really hard.
Right.
There's a saying that I love. I change it a little bit. In front of every new idea are 1,000 angry people appointed to guard the past. Now, that doesn't mean every new idea is good, but it deserves to be looked at. And it is just so hard for people to step back. And my favorite story is Candace Pert. I don't know if you know her name.
No.
Candace was a graduate student, and I believe she was at Hopkins. And she was working for under Dr. Solomon, who was her supervisor. And Candace was brilliant. And at that time, the only neurotransmitter that was identified was acetylcholine, okay? One of your smart chemicals. And she discovered the rest of the neurotransmitters, all of them. And she named them the Hoffman-LaRoche receptors because we knew that antidepressants work, but we didn't know why. Okay, at that time, I mean, we used aspirin and didn't know why for 70 years, why it worked. And so that work got the equivalent of a Nobel Prize. And they said, we will not give it to her. You, Dr. Solomon, have to receive it. He said, I did not do the work. It was all her innovation. She's the one that did the work. And they said, it doesn't matter. You don't get the award if you know, we won't give it to her. She's only a graduate student.
Wow.
And so they said, but she can come sit next to you. And at the awards, there was an empty chair next to him. And she went on to NIH and she started mind-body medicine.
Wow. What was
with
the name again?
Candace Pert, P-E-R-T. And she was amazing. And when I was getting ready to write a book, she said, I will give you a blurb if you will talk about environmental toxins.
Mm.
And I never wrote that book.
Hmm.
We started to write it, but it fell through. And Candace died, I think, at about 57 or 58. But I wondered how long she would last at NIH, because she was, you know, she changed the names of things.
Yeah.
And so mind-body medicine, and it's psychoneuroimmunology, you know, now you're looking at this group name that addresses how we look at people, you know, and instead of in pieces. And so she had this wise saying, and she said, when they're driving you out of town, when they're running you out of town, carry a flag and look like you're leading a parade. And I actually gave that advice to a doctor who was being called before a board, one of the medical doctors for alternative medicine treatments. And I said, you hold your head up, carry a flag, be proud to explain what you do.
Right.
And have your references and your resources. And I said, I sat on 2 boards, the dental board, and then I sat on the board for dietetics and nutrition in DC and Maryland, and I helped write the legislation for both those boards, not the dental. Well, I did with the dental hygiene placement. Yes, I did work on that. But I told him, I said, you've done nothing wrong. They're ignorant. They don't understand the treatment you're using. So you need to educate them and be excited. Walk in there like they're going to give you an award. And so the next time I saw him at a meeting, he said, I did exactly what you said. And it worked out wonderfully.
Great.
And so, you know, everybody I worked for got called before a board for something. Do you know what they used to get called before the board for? In Maryland, in the 70s, if you told people to eat more of a plant-based diet for protecting heart disease and cancer from those, that was quackery. And you would be called before the board. Now, you don't hear that anymore because they know, I mean, nobody's going to be stupid enough in this day and age to say that. And so it's been a long haul from, you know, being quacks. I used to say that's really a badge of honor. So
it's a long, long time. I mean, the last time we talked, we said at least 20 years, at least historically, that's been the case. Maybe it'll be faster with the age of the internet, but historically, for science to impact public policy, it takes 20 years. But it sounds like with the mercury issue, it's been a lot longer than that. But like you said, you know, it's so hard to change a big, heavy ship in a small direction. And when it's so ingrained.
That's a good metaphor. And I think that some of the fear is that if it is determined that people should not have mercury in their mouth, and every study done outside of the dental organization says it's damaging, but done under the aegis of dentists, well, it's fine, it's safe. And I think the fear is that every dentist is going to get sued, right. You know, so you really have to have a moratorium. and say after July 1st of XYZ year, anybody who uses amalgams, mercury amalgams, can be sued. And to me, I think that's the fear. A lot of times, you know, things are fear-based. Am I going to get in trouble because I've been using that? I got out of dental school and that's what they told me to use.
Right.
And that's what you take the exam on.
Right.
The dental exam. But
it took a long time to get lead out of gasoline and lead out of paint. And one more thing before we change subject on the whole mercury thing. If there's anybody who does have 10 mercury fillings in their mouth, I don't recommend getting all 10 removed all at once. Because you mentioned, you know, everybody from a genetic standpoint has different abilities to biotransform or detoxify. It depends on what their toxic load is in addition to the mercury. And you should see someone who is skilled at the removal. So a biological or integrative or functional dentist. I asked my regular dentist about it and she told me that she's not comfortable removing mine because we release more mercury vapors when we take out the fillings. And I was glad that she, you know, admitted that.
That was interesting.
Yeah. Yeah. So another topic that I wanted to bring up about the microbiome. So we talked about, you know, the bacteria in our mouths. We have to have bacteria to live. There is a symbiotic relationship with us and our bacteria. But like the bacteria can get out of balance in our gut, it can get out of balance in our mouth. P. gingivalis was mentioned as one of the concerning ones on one of your slides, and there's several others, but I don't have it at the top of my memory, but there is a test, maybe it's oral DNA, where you can take a sampling to see if you have concerning bacteria in your mouth. And are you familiar with that? And
yes, and there's also a fecal test for bacteria. You know, the United States was way behind in using probiotics. Doctors would say, no, you're going to get an infection. You can't take a bacteria, you're going to get infections. Where in Europe, they were standard, you know, one hand the antibiotic, the other hand the probiotic. Right. And so I think, I mean, I interviewed a lot of researchers on probiotics, and some of them give you the idea that you can really transform the gut by selecting just certain specific bacteria and giving enough. We're not that good. You know, I just don't buy that. And I think giving probiotics is important, but I think we are way ahead of ourselves thinking that we are so smart, we can pick out exactly what is needed. Maybe we know 10% of what the microbiome is. Now it's getting, our knowledge is expanding tremendously because we're doing those tests on people. And we're able to say, okay, we can support this gut better. I like to use biotin. Biotin generates, biotin is generated from the microbiome. And it's important for immunity. We make a small amount of supplements in the gut, and biotin's one of them, but they're destroyed by antibiotics. And so it becomes a problem. And this is why I like to use biotin 5 to 10 milligrams. Number one, it's extremely inexpensive and it has no known toxicity. And what you're doing, my experience has been, you really can't clean up that gut well without using biotin. If somebody's had a lot of antibiotics, chances are they're not generating biotin. And so that, you know, that's been very important to me with patients. And I use a variety. They have a lot of breakdowns of probiotics for vaginal health, for GI health. I like what I'm seeing and what the manufacturers are putting out. And for women, for men, for kids, for infants, it's exciting. It's an exciting time to me. But what's interesting, Laurel, is years ago, when we first started using probiotics, the count was in 1,000. Okay. And we helped people. And they weren't refrigerated. And one person called me and she said, thank you, thank you, thank you. My yeast infection went away. I did exactly what you said. I took 10 capsules 3 times a day. And I had not said that. That was either a mistake on my part. And I thought, oh, and she said, it worked. Aha. Serendipitous.
Right.
And
the billions.
And now we're in, the national debt is your goal for probiotics. And good luck, Charlie. It's hard. And in Western cultures, we have 25% of the number of species that we should have in our gut. We have a lot of that 25%, but we need other species. And this is compared to natural cultures.
Right.
And we don't come close.
Right.
We don't come close. And can you even get enough? We do. I was at a meeting where they introduced fecal transplants, and they're miraculous.
Right.
I actually didn't think medicine would take that up. I thought, that's not going to fly. Well, it did, because when you see a patient who's on death's door and within days or a week, they completely get better.
Right.
It has to make you think, oh my goodness.
Right.
These
bugs are more powerful than we knew. Yeah. I talk to my clients about, nourish these little bugs, because there is such a relationship that we have to support and honor and love these little guys, because we need them to survive. And so there are some probiotic rinses. We want to avoid antibacterial mouthwash for a variety of reasons. Do you want to touch on probiotics for the mouth and the reason why we don't want to use antibacterial mouthwash? Well,
because it's going to kill the good guys too. And also the alcohol-based mouthwash. They actually increase the risk for oral cancers, the alcohol-based, and people are learning that. I was in a pharmacy and I heard somebody say, we have to get one that doesn't have alcohol in it. And they're reading the labels. And I said, here's one that doesn't have the alcohol.
Yeah.
And for years we've done swish and swallow when people had thrush, to swish and swallow. It makes sense.
So they're swishing
probiotics. Yeah.
Right.
Let it go all the way.
Yeah. Yeah. So we've talked about a lot of different topic areas. If there's someone listening and they want to know, okay, what are the areas, what can I take home from this that I can start tomorrow to protect my, to reduce inflammation in my mouth, to protect my brain, my heart, to reduce systemic inflammation that could be caused by a problem in my mouth? What do I do? What are some words of wisdom?
Well, I do like people to have a baseline multiple for age, stage, and gender. And there are certain companies that I recommend. It's hard to make the list because some of them, not all of them make all of their products that are just the way you would want them. But there's a lot of companies out there, and they're using testing that is based on GMP, good medical practices. And that is helpful because that's something.
What do you mean by a baseline multiple?
A multiple for age, stage, and gender. So if you're pregnant, you're a female, or you're a teenage girl, or you're a teenage boy, or you're an infant, or you're older, and older people, their needs are higher. And for whatever reason, the Institute of Medicine says that older people don't have as high a need.
So what are you getting as a baseline?
A baseline that would have B vitamins, vitamin A, vitamin D, vitamin E, and if somebody knows they've got the MTHFR factor, then they'd want to have methylated active forms of the B vitamins, particularly B12 and folate. And then from there,
so you were talking about a baseline multivitamin to support nutrition. Okay, got it.
Right. And if you don't know anything about it, you can, even in a health food store, there are often people that have excellent educational information for clients that visit, but you also want a probiotic. And they make them for teens and women and men. And omega-3 is real important, especially if somebody is not eating seafood.
Your number was pretty high when you listed the EPA DHA. I think you said between 3,000 and 5,000 grams. I just wanted to point that out because most people don't take that much. And this is Rocco. So I will hone in on that in a future post because even my husband who lives with me will sometimes go to the store and pick up a real cheap bottle of less than ideal supplements. And so when you mentioned, the standard, it should be third-party tested. It should be a high-quality supplement, so you know what you're getting. That's just my soapbox. I'll get off of that, but okay. So go back to your list.
Well, and so we said omega-3s, and if a woman is not consuming calcium foods, we want to do a calcium, and I like the ones that have magnesium. You cannot take calcium without at least half as much magnesium or a 1-to-1 ratio, because you will increase the risk for kidney stones and hardening of the arteries. And so docs have been putting women on 1,500 of calcium only. Huge mistake. And they stopped that study.
Right.
Because women were developing cardiovascular problems. There was a group of women who did well, and I'll bet you that group was taking magnesium.
Mm.
And so it's like the fingers on your hand. You can't evaluate what your hand's ability by looking at one digit at a time.
Right.
You can't do that. And that's how they study supplements.
Right.
Their magnesium and B6 are cohorts, and there's synergisms and there's opposite effects, antagonisms. And so it's important to know that. And the most important thing is that I tell people is it's very difficult to achieve toxicity with supplements. The body knows what it needs. So when you're deficient, and I call it having a nutrient bank account for each nutrient, your body puts out signals to absorb more from the gut and to retain more from, and not, you know, so that you don't pee it out. And as your nutrient bank accounts fill up, you'll absorb less and retain less. This is why the fatality rate from supplements is 0.0001%. And yet there's this move by pharmaceuticals to require that they go through the testing that they do with drugs. So that if you make a B complex and you decide to add pantothenic acid, then you've got to go through more testing. And I love that one of the congressional, one of my favorites, would say, show me the bodies. Where are the bodies? How many dead people do we have from this? Now, there have been some toxicities because of a toxin being put in to a supplement. Some have been intended, unintended. But that being said, I've seen one toxicity in my whole career. It was a man who was taking vitamin A, and I didn't know it, and we knew he had toxic A. And so finally I said, let me come over to your house, show me everything. And there it was, 50,000 units of A a day for years.
Wow.
Not a month, years. He had liver damage, and of course we took him off of it. And he would say, well, my wife gives me something too. And that was it. And his liver cleared up. It took months. And that was educational, because you're given the impression by the Institute of Medicine that if you take 150,000 units of vitamin A, you're going to drop dead. It's toxic. When Eskimos consume more than that, you know, and of course they're unique. In Inuit people, they're unique and they have higher needs for those fat solubles. But that doesn't mean you're careless with what you're doing. But the body knows it has to. We wouldn't be here if we had to assess ourselves since the beginning of humans living on this planet. How ancient people had all this wisdom about foods and herbs and healing. They had a natural wisdom that they developed, I guess they observed, you know, over time. But we still today, how would you know how much A you need unless you did a test? And who's going to do tests all the time?
Right.
You know, we do have good tests that we use on patients, and they do give us good information. So it's, you know, it's interesting that people get so worked up about that supplements are dangerous, and it's just not true.
Right. So when I asked you about things that we could recommend for oral health, I had no idea you were going to start on supplements. So you gave a list of things that are good for the body in general, which are also going to be good for the oral health. So that's on top of flossing and brushing, I guess. Yes?
Yes, of home care. But the reason I did that little study on those twins was I wanted to see how much difference it would make.
That was
if
dramatic.
I didn't teach them to floss and brush.
That's dramatic.
And I couldn't believe it myself.
Mm-hmm.
It was extreme. And I love that comparison, but it also shows what it looks like. If your gums look like that, you're in trouble. If your breath stinks and your wife is complaining or your husband's complaining, something's wrong. And you've got to go through a dental workup and a medical workup to figure out. I had a friend whose breath would become horrible, and I thought it might be a dental source. And she said, I go very regularly. she ended up having an intestinal cancer, stage 4.
Wow.
And when what I sensed in the smell was necrosis.
Right.
And it wasn't all the time, you know, it wasn't all the time, but it's very definitive. And if you have bleeding, if every time you brush there's bleeding, then your gum tissue isn't healthy. Vitamin C is the best thing you can do for your gum tissue.
Okay. And that visual is going to stay in my mind. So thank you for sharing that. I had no idea that the power of nutraceuticals on oral health. I really didn't. So that was very worthwhile. And I've kept you after our hour. I said to put an hour on your calendar. Is there anything that you want to share before we sign off?
Well, I think we've talked a lot. I did, when I started integrating nutrition in my dental practice, I had a patient who had diabetes, and I had put her on supplements. And her doctor called me and said, "You have no right to be treating my patient for diabetes." I said, "I'm not. I'm using supplements because she has some oral issues with her gum tissue, and I can't help it that her numbers have improved."
Sorry.
That's the truth. That is the truth. And that shows you, you know, that when I got into the functional medicine groups, we had all kinds of specialists together, and we would take a patient, and there might be 6 or 7 of us, and we would look, and one woman cried, and she said, "I have never been evaluated completely. When I called and said I had a sore arm, my doctor, or both arms, the doctor said I only have time to look at one."
Wow.
And see, we're still doing it. In medicine, it's like, okay, if it's high blood pressure, you have 15 minutes.
Right.
You know, and the patient has to come back. This is why concierge practices are going to take off.
Right.
You know, but it requires a patient that values good care and somebody who's going to be more thorough. And they're the patients that are going to want the better testing. And they're going to want more preventive care. So it's, you know, it's changing. It's a little too slow sometimes.
Right. Yeah. I feel lucky as an occupational therapist. I mean, usually a minimum time frame for a treatment is 60 minutes. I mean, sometimes when I'm doing an evaluation, it might be longer than that. And I often will put oral health as a goal. So just so you know, but I have not yet seen a dental hygienist in a skilled nursing or assisted living. So I hope that your wishes come true sometime soon, because I think that's a good idea.
Well, one of my friends works in the county clinics as a dental hygienist, and it's volunteer. They might get paid something, I'm not sure, but there are dentists and dental hygienists. And so dentistry is way ahead of medicine. And in medicine, that recommending the diet, if we recommended the diet, we all moved to the District of Columbia, not because they were smarter, but because they didn't pay attention to what offices were doing. And we were told, if you're recommending diet for any illness, you're treating a condition that doesn't exist. And see, dental hygienists do that. We treat conditions that don't exist.
The focus is on prevention.
And there was some kind of a meeting, and in Congress, they said to the president of the Dental Association, "Sir, congratulations for being head of the first profession to try to put itself out of business.
Right.
You know, and so you know, medicine is thinking more preventively. It's catching on.
Well, good for you, and happy Dental Hygiene Month, and good for you for continuing to focus your career path, your mission on prevention and helping people live with optimal wellness. So,
by the way, I learned how to recognize all kinds of diseases from the mouth.
yeah.
And was able to pick out some that we thought, you know, we were trained, and the first signs would show up in the inside of the cheeks. And I just remembered that. And so, and I checked everybody's thyroid, and I did in my career find 3 cancers, found a lot of polyps. And I sent people, you know, to their doctor, and one woman had to go to 3 doctors. I said, you need an ultrasound. You're hot right here.
Mm.
That's your thyroid. It's hot.
Yeah.
And I said, have the doctors touched you? She said, no, they won't do the ultrasound. And she finally found a doctor that did. And she called me and said, I'm in the hospital. I'm having my thyroid removed. It was cancer.
Wow.
And I thought, they didn't touch her. You know, your patient, it's reading the patient. And it's not hard to do this and tell if it's too hot. It's unbelievable.
Yeah. But coming from a different framework. So yeah. Thank you for coming from your framework of prevention and touching people and spreading health. Yeah.
Yeah. So and you too. You do a great job, Laurel.
Thanks, Dana. Good to see you and talk with you tonight. And we'll stay in touch. Thanks for sharing your wisdom today.
Okay.
Take care.
Bye.
Bye.